The Whangarei Child Poverty Action Group and the Whangarei branch of social service providers Aotearoa jointly hosted a post-budget lunch event on Friday the 28th of May, one of a number of such events held throughout the country. The gathering's intention was to provide analyses of Thursday's budget in terms of implications for child poverty both locally and nationally. It will also provide an opportunity for participants to consider local initiatives to address child poverty alongside local organisers in areas like housing and welfare. One of the keynote speakers, Associate Professor Mike O'Brien, is National Child Poverty Action Group's Social Security spokesperson and former director, and is currently based at the School of Counselling, Human Services and Social Work University of Auckland. He shared his analysis of the government's annual budget in relation to child poverty.
I think there's some pretty good evidence that if we got housing right, both in terms of cost and in terms of quality of housing, we'd make an enormous difference. But the budget won't make much headway on that because there's no real plan for developing affordable housing across the country. There's some worries about housing in terms of homelessness, and social housing, but that's very much temporary kind of arrangements. There's no indication in the budget around improving the supply of homes at an affordable level across the country, particularly in Auckland, but it's not exclusively an Auckland issue, it's an issue across the country, and there's no real commitment to moving on that front. We started in Auckland in the early 1990s, and then subsequently a number of groups have developed around the country, here, Dunedin, Wellington, Hamilton, and so that we've worked as a kind of network without having a formal kind of national structure, with active people committed to what's happening in the region. There are some issues that are particular to Whangarei and the north, obviously, around particularly what's happening for Māori children, who are significantly overrepresented in the poverty statistics and in the poor housing statistics.
The luncheon was well attended with a full house of people from a variety of backgrounds, all concerned with the welfare of Northland communities they represent, from the Northland DHB to local leaders.
Well, we're pleased to see that the budget has some ongoing funding for healthy homes. That's been a really important program for Northland. We know that there's a really high correlation between poor, damp housing and health, particularly for children and for older people with heart conditions and lung conditions. So that's good, although we'll need to see how that goes on in the out years. In terms of the overall impact of the budget, really it's not even keeping up with the health needs and the health budget overall, so it's disappointing in that sense. Well, I think it's very obvious that people have become more aware of the inequalities in our society and the impact that's having on the health of our communities, and especially our children. And there's also a lot more evidence around about that and a lot more discussion about the fact that it's really the very early years of life and even during pregnancy that are very important to address if we're going to see good health in the future.
For us, this is not just talking about it, we actually live it, and we're having to deal with this day to day, every day of our lives, not just something that's fleeting. Specifically, we're dealing with whānau, with children who are from one end of the spectrum right through to the other on a daily basis.